Question 1. Cost-benefit analysis shows that implementing a specialized diet and regular physiotherapy for a senior dog with arthritis would significantly increase operational expenses. However, the dog is showing signs of discomfort and reduced mobility. What is the most appropriate course of action to ensure the animal's welfare and comply with professional standards? Option A. Continue with the current standard care plan, as the increased costs associated with specialized interventions are not justifiable for an older animal. Option B. Recommend euthanasia immediately due to the anticipated ongoing costs of managing the animal's condition. Option C. Implement a basic, low-cost pain relief medication without further veterinary consultation, assuming it will be sufficient. Option D. Consult with a veterinarian to develop a tailored pain management and mobility plan, exploring all available dietary and therapeutic options, and discuss the findings and recommended care with the animal's owner or management, advocating for the animal's needs. Correct answer is D. Consult with a veterinarian to develop a tailored pain management and mobility plan, exploring all available dietary and therapeutic options, and discuss the findings and recommended care with the animal's owner or management, advocating for the animal's needs. Explanation. This scenario presents a professionally challenging situation because it requires balancing the immediate financial implications of providing specialized care against the ethical and legal obligations to ensure the welfare of a vulnerable animal. The challenge lies in the potential for cost to influence decision-making, which can conflict with the duty of care mandated by the Certificate Roman III in Animal Studies Health and Welfare Curriculum and associated Australian animal welfare legislation. Careful judgment is required to prioritize the animal's needs while remaining mindful of resource constraints, a common reality in animal care settings. The correct approach represents best professional practice because it prioritizes the animal's welfare and quality of life, aligning with the core principles of animal health and welfare. This approach is ethically sound, as it upholds the responsibility to provide appropriate care regardless of an animal's age or special needs. Legally, it adheres to the Prevention of Cruelty to Animals Act, or equivalent state/territory legislation in Australia, which mandates that animals must be provided with adequate food, water, shelter, and veterinary care, and that suffering must be prevented. This proactive and compassionate approach ensures compliance and demonstrates a commitment to professional standards. An incorrect approach that focuses solely on cost without adequate consideration for the animal's needs would represent a significant regulatory and ethical failure. This could contravene the duty of care provisions within animal welfare legislation, potentially leading to charges of neglect or cruelty if the animal's condition deteriorates due to insufficient care. Ethically, it demonstrates a disregard for the animal's intrinsic value and suffering, violating the professional code of conduct expected of Certificate Roman III graduates. Another incorrect approach that involves making assumptions about the animal's comfort or needs without consulting veterinary advice or appropriate resources is also a failure. This bypasses essential professional due diligence and could lead to misdiagnosis or inappropriate management, causing harm and failing to meet the standards of care expected in animal studies. Professionals should use a decision-making framework that begins with a thorough assessment of the animal's specific needs, consulting with veterinarians and experienced animal handlers. This assessment should then inform a care plan that outlines necessary interventions, including specialized diets, medication, environmental modifications, and regular monitoring. The cost implications of this plan should be discussed with management or owners, exploring all available options for funding or resource allocation. If the ideal care plan is financially prohibitive, the professional's role is to advocate for the animal by presenting the risks of inadequate care and exploring all feasible alternatives that still meet a minimum standard of welfare, rather than simply abandoning necessary care due to cost. Question 2. The investigation demonstrates a young Labrador Retriever puppy, aged 10 weeks, exhibiting a noticeable lack of muscle development and appearing significantly smaller than littermates observed in previous weeks, despite receiving a commercially available puppy food. The puppy is otherwise alert and interactive. Considering the growth and development stages in animals relevant to the Certificate Roman III in Animal Studies Health and Welfare, which of the following represents the most appropriate initial assessment and course of action for an animal care professional? Option A. Focus on increasing the quantity of the current puppy food, believing that more food will stimulate faster growth. Option B. Attribute the lack of muscle development to a lack of exercise and encourage more vigorous play sessions. Option C. Assume the puppy is a naturally smaller individual and will catch up in size as it matures. Continuing with the current feeding plan. Option D. Conduct a detailed physical examination. Assess the puppy's body condition score, review its feeding regime and intake, and consult veterinary resources or a supervisor regarding potential causes for the delayed development. The correct answer is D. Conduct a detailed physical examination, assess the puppy's body condition score, review its feeding regime and intake, and consult veterinary resources or a supervisor regarding potential causes for the delayed development. Explanation. This scenario presents a common challenge in animal care, identifying and responding to deviations from expected growth and development patterns. The professional challenge lies in accurately assessing the animal's stage of development, recognizing subtle signs of abnormality, and determining the appropriate course of action based on established welfare standards and regulatory requirements. Misinterpreting these signs can lead to delayed intervention, potentially impacting the animal's long-term health and welfare, and could also contravene the duty of care expected under the Certificate Roman III in Animal Studies Health and Welfare Curriculum. The correct approach involves a thorough, evidence-based assessment of the animal's physical and behavioral characteristics against known developmental milestones for its species and age. This aligns with best professional practice by prioritizing the animal's welfare and adhering to the principles of responsible animal husbandry. Specifically, it reflects the requirement to monitor animal health and welfare, identify signs of ill health or distress, and report concerns, as would be expected of a Certificate Roman III qualified individual. This proactive and informed approach ensures that any developmental issues are addressed promptly and effectively, minimizing potential suffering and promoting optimal growth. An incorrect approach that relies solely on anecdotal evidence or superficial observation fails to meet the professional standards required. Such an approach could lead to overlooking critical developmental issues, thereby failing to uphold the animal's right to appropriate care and potentially breaching the duty of care. For instance, attributing a lack of expected weight gain to simple laziness without further investigation ignores the possibility of underlying health problems, which is a regulatory and ethical failure. Similarly, assuming a young animal is simply slow to mature without considering species-specific growth rates or potential nutritional deficiencies demonstrates a lack of due diligence and a failure to apply learned knowledge from the Certificate Roman III curriculum. These failures can result in prolonged suffering for the animal and a breach of the duty of care to provide a safe and healthy environment. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and record detailed information about the animal's physical condition, behavior, and environment. 2. Compare these observations against established developmental norms for the specific species and age group, referencing reliable resources. 3. Identify any discrepancies or deviations from expected patterns. 4. If deviations are noted, consider potential causes, including health, nutrition, and environmental factors. 5. Consult with a supervisor or veterinarian if there is any uncertainty or concern about the animal's welfare. 6. Implement appropriate interventions or management strategies based on the assessment and professional advice. 7. Continuously monitor the animal's progress and adjust care as needed. Question 3. The audit findings indicate that while no animals in the facility are exhibiting obvious signs of disease or injury, some are displaying behaviors such as repetitive pacing, excessive vocalization, and a reluctance to interact with handlers. Based on the principles of animal health and welfare relevant to the Certificate Roman III in Animal Studies Health and Welfare, which of the following best describes the appropriate response to these findings? Option A. Initiate a comprehensive welfare assessment, considering the 5 freedom/domains, to identify potential stressors and implement environmental or behavioral enrichment strategies. Option B. Advise management that these behaviors are normal for the species and do not warrant further investigation unless they escalate to overt signs of distress. Option C. Conclude that animal welfare is satisfactory as there are no visible signs of illness or injury, and no immediate veterinary intervention is required. Option D. Recommend adjusting feeding schedules to see if this impacts the observed behaviors, as dietary changes are often the simplest solution to behavioral issues. The correct answer is A. Initiate a comprehensive welfare assessment, considering the 5 freedoms/domains, to identify potential stressors and implement environmental or behavioral enrichment strategies. Explanation. The audit findings highlight a common challenge in animal care settings: the subjective interpretation of animal health and welfare. This scenario is professionally challenging because it requires the application of established definitions and principles to observable behaviors and conditions, demanding careful judgment to ensure compliance with the Australian regulatory framework for animal health and welfare, as relevant to the certificate Roman 3 in Animal Studies Health and Welfare. The correct approach represents best professional practice because it directly aligns with the core principles of animal welfare, as defined by Australian legislation and industry guidelines. It moves beyond a superficial assessment to consider the 5 freedoms, or 5 domains, depending on the specific context and evolution of welfare science, which are foundational to understanding and ensuring an animal's well-being. This approach requires observation, interpretation, and action based on a comprehensive understanding of what constitutes good health and freedom from distress, thereby fulfilling the duty of care mandated by regulation. An incorrect approach that focuses solely on the absence of overt disease symptoms fails to meet regulatory requirements. Animal welfare extends beyond mere physical health. It encompasses psychological and environmental factors. Ignoring signs of stress, fear, or discomfort, even in the absence of visible illness, constitutes a failure to uphold the animal's welfare as defined by the relevant Australian Animal Welfare Acts and Codes of Practice. Another incorrect approach, which prioritizes owner convenience or perceived economic viability over the animal's needs, is ethically and regulatorily unacceptable. Australian animal welfare legislation is designed to protect animals from suffering and to ensure their needs are met, irrespective of human convenience or financial considerations. Such an approach demonstrates a disregard for the animal's intrinsic value and the legal obligations of care. A further incorrect approach, relying on anecdotal evidence or personal opinions without reference to established welfare indicators or veterinary advice, is unprofessional and potentially harmful. Professional decision-making in animal health and welfare requires a systematic, evidence-based approach. This involves understanding the animal's species-specific needs, recognizing signs of distress or ill health, consulting relevant guidelines and legislation, and seeking professional veterinary input when necessary. Professionals must adopt a proactive stance, continuously assessing welfare and intervening appropriately to prevent suffering and promote well-being. Question 4. Performance analysis shows that a newly introduced foraging toy has led to increased activity in a group of rabbits, but also a slight increase in nipping between individuals. Considering the principles of animal enrichment and welfare as applied within the Australian regulatory framework for animal studies, which of the following interpretations and subsequent actions best reflects professional best practice? Option A. Nipping is a clear sign of negative welfare, and the foraging toy should be immediately removed as it is causing distress and conflict within the group, regardless of the increased activity. Option B. The foraging toy is likely providing a valuable outlet for natural foraging behaviors, and the increase in nipping warrants further observation to determine if it is a stress response to competition for resources or a normal social dynamic, with potential adjustments to toy placement or quantity if necessary. Option C. The foraging toy has proven ineffective because it has introduced conflict, and a different type of enrichment that does not involve competition for resources should be provided without further investigation into the cause of the nipping. Option D. The increased activity indicates successful engagement, and the nipping is a minor social interaction that does not require intervention, as the primary goal of enrichment is to stimulate behavior. The correct answer is D. The increased activity indicates successful engagement, and the nipping is a minor social interaction that does not require intervention, as the primary goal of enrichment is to stimulate behavior. Explanation. This scenario is professionally challenging because it requires the application of theoretical knowledge about animal enrichment to practical, real-world situations involving different species and their specific needs. The challenge lies in accurately assessing the impact of enrichment on behavior and making informed decisions that promote animal welfare within the scope of the certificate Roman 3 in Animal Studies Health and Welfare Curriculum, which is grounded in Australian animal welfare legislation and industry best practices. The correct approach represents best professional practice because it demonstrates a thorough understanding of how enrichment directly influences an animal's psychological and physical well-being. It involves observing and interpreting behavioral changes, linking them to the provided enrichment, and making evidence-based adjustments. This aligns with the principles of responsible animal care mandated by Australian animal welfare standards, which emphasize providing environments that meet an animal's physical, behavioral, and psychological needs. Specifically, it reflects the duty of care to prevent suffering and promote positive welfare outcomes. An incorrect approach that focuses solely on the novelty of the enrichment item without assessing behavioral response fails to meet the regulatory requirement of ensuring the enrichment is actually beneficial. It is ethically deficient as it prioritizes superficial aspects over the animal's actual welfare. Another incorrect approach that assumes all animals of the same species will react identically to enrichment overlooks individual variation and the importance of species-specific behavioral needs, potentially leading to ineffective or even detrimental enrichment strategies. This contravenes the ethical obligation to treat each animal as an individual and to understand their unique requirements. An approach that dismisses subtle behavioral changes as insignificant ignores the cumulative impact of enrichment on an animal's overall welfare and stress levels, which is a failure to proactively identify and address potential welfare concerns as required by good animal husbandry practices. Professionals should use a decision-making framework that begins with understanding the specific behavioral repertoire and needs of the species and individual animal. This involves researching appropriate enrichment types, implementing them systematically, and then meticulously observing and recording behavioral responses. The data gathered should then be analyzed to determine the effectiveness of the enrichment and whether modifications are necessary. This iterative process of implementation, observation, and adjustment, guided by an understanding of animal behavior and welfare legislation, ensures that enrichment strategies are not only provided, but are also demonstrably beneficial to the animal. Question 5. The monitoring system demonstrates a consistent elevation in the animal's respiratory rate and a slight decrease in its heart rate over the past hour, deviating from its normal resting parameters. Option A. Contact a veterinarian immediately for assessment and guidance. Option B. Continue monitoring and record the readings for the next scheduled check. Option C. Assume the readings are inaccurate and recalibrate the monitoring equipment. Option D. Administer a mild sedative to calm the animal and observe for changes. Correct answer is A. Contact a veterinarian immediately for assessment and guidance. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal care professional to interpret physiological data and make a timely, informed decision regarding an animal's welfare. The challenge lies in distinguishing between normal variations and potentially critical deviations that could indicate a serious health issue, necessitating prompt intervention. The professional must balance the need for immediate action with the risk of unnecessary stress or intervention for the animal. Correct approach analysis. The correct approach involves recognizing that a sustained, significant deviation from the animal's baseline physiological parameters, particularly in multiple systems, warrants immediate veterinary attention. This aligns with the principles of animal welfare legislation in Australia, such as the Prevention of Cruelty to Animals Act (POCTA) in Victoria, which mandates that persons in charge of animals must take reasonable steps to alleviate pain, suffering, or distress. Prompt veterinary consultation is the most responsible and legally compliant action to ensure the animal receives appropriate care and to prevent potential suffering. Incorrect approach is analysis. One incorrect approach is to dismiss the readings as a temporary anomaly without further investigation. This fails to meet the duty of care required under animal welfare legislation. If the readings indicate a genuine physiological problem, delaying veterinary assessment could lead to prolonged suffering, which is a breach of ethical and legal obligations. Another incorrect approach is to administer unprescribed treatments based on an assumption of the cause. This is dangerous as it bypasses qualified veterinary diagnosis and could exacerbate the animal's condition or cause adverse reactions. It also constitutes practicing veterinary medicine without a license, which is illegal. A further incorrect approach is to simply record the readings and wait for the next scheduled observation period without assessing the severity or trend. While record keeping is important, it does not absolve the caregiver of the responsibility to act when an animal's welfare is potentially compromised. This passive approach could lead to a critical deterioration of the animal's health before any intervention occurs, violating the duty of care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes the animal's immediate welfare. This involves 1. Recognizing and recording abnormal physiological signs. 2. Assessing the severity and trend of the abnormality in the context of the animal's species, age, and known health status. 3. Consulting with a veterinarian for diagnosis and treatment advice when significant deviations or concerning trends are observed. 4. Implementing veterinary recommendations promptly and accurately. 5. Continuously monitoring the animal's response to treatment and reporting any further changes. Question 6. The control framework reveals that Certificate Roman III in Animal Studies Health and Welfare Professional is tasked with assessing the health of a domestic cat. Which of the following techniques, when employed as the primary method of assessment, best aligns with the principles of proactive animal health monitoring and the Prevention of Cruelty to Animals Act 1979, NSW? Option A. Observing the cat's general demeanor, posture, coat condition, and respiratory rate, while also noting its interaction with its environment and any unusual vocalizations. Option B. Performing a brief visual inspection of the cat from a distance, assuming it is healthy if no immediate, dramatic abnormalities are apparent. Option C. Relying solely on the owner's report that the cat is eating and drinking normally, without conducting any independent physical observation. Option D. Waiting for the cat to exhibit obvious signs of pain, such as limping or crying out, before initiating any health assessment. The correct answer is A. Observing the cat's general demeanor, posture, coat condition, and respiratory rate, while also noting its interaction with its environment and any unusual vocalizations. Explanation. This scenario is professionally challenging because assessing animal health requires a nuanced approach that goes beyond simply observing obvious signs of distress. It demands a systematic risk assessment to identify potential health issues before they become severe, ensuring compliance with the Prevention of Cruelty to Animals Act 1979, NSW, and the Australian Animal Welfare Standards and Guidelines for Livestock. Professionals must integrate observational skills with an understanding of normal behavior and physiological parameters for the specific species. The correct approach represents best professional practice because it involves a comprehensive, multifaceted assessment. This includes observing the animal's general appearance, behavior, and environment, as well as performing physical examinations and considering the animal's history. This thoroughness aligns with the duty of care mandated by animal welfare legislation, which requires individuals to take reasonable steps to prevent suffering. By systematically evaluating various indicators, a more accurate and timely diagnosis can be made, leading to appropriate interventions and preventing potential breaches of welfare standards. An incorrect approach that focuses solely on overt signs of pain or distress is professionally unacceptable. This failure to conduct a proactive and comprehensive assessment could lead to delayed intervention, exacerbating an animal's suffering and potentially violating the duty of care under the Prevention of Cruelty to Animals Act 1979, NSW. Relying only on readily apparent symptoms neglects the subtle indicators of ill health that a trained professional should be able to detect, thereby failing to meet the standards of care expected under the Australian Animal Welfare Standards and Guidelines for Livestock. Another incorrect approach, such as assuming an animal is healthy if it is eating and drinking normally without further observation, is also professionally unacceptable. While appetite and hydration are important indicators, they do not encompass the full spectrum of health. This oversight could miss underlying conditions that do not immediately affect food or water intake, leading to a failure to identify and address health problems promptly, which is a breach of the duty of care. The professional reasoning process for similar situations should involve a structured risk assessment. This begins with understanding the species-specific normal behavior and physiology. Next, a systematic observation of the animal's general condition, environment, and behavior should be conducted. This should be followed by a physical examination, if appropriate and safe, to assess vital signs and identify any abnormalities. Finally, all gathered information should be integrated to form a professional judgment about the animal's health status and to determine the necessary course of action, always prioritizing the animal's welfare and adhering to relevant legislation and guidelines. Question 7. Benchmark analysis indicates that effective animal welfare monitoring relies on recognizing a range of behavioral cues. A handler observes a dog in its kennel that is typically active and engaging, now lying down with its ears slightly back, occasionally licking its lips, and showing minimal interest in interaction. Which of the following actions best demonstrates adherence to the principles of animal health and welfare as expected in the Certificate Roman III in Animal Studies Health and Welfare? Option A. Continue with routine tasks, assuming the dog is simply tired and will recover on its own. Option B. Assume the dog is being stubborn or lazy and try to encourage it to be more active through loud verbal commands. Option C. Offer the dog a treat to see if it improves its mood, and if not, assume it is not a significant issue. Option D. Immediately report the observed behavioral changes to a supervisor or veterinarian, noting the specific signs of lip licking and ear position. Correct answer is A. Continue with routine tasks, assuming the dog is simply tired and will recover on its own. Explanation. Scenario analysis. This scenario is professionally challenging because accurately identifying and responding to subtle stress indicators in animals requires keen observation skills, an understanding of species-specific behaviors, and the ability to differentiate normal behavior from signs of distress. Misinterpreting these signs can lead to delayed or inappropriate interventions, potentially exacerbating the animal's welfare issues and contravening regulatory requirements for animal care. The pressure of daily tasks can also lead to overlooking critical behavioral cues. Correct approach analysis. The correct approach involves a systematic and informed assessment of the animal's behavior in its environment. This aligns with the principles of responsible animal care mandated by the Certificate Roman III in Animal Studies Health and Welfare curriculum, which emphasizes proactive welfare monitoring. Specifically, it requires knowledge of common stress indicators for the species in question, such as changes in posture, vocalization, activity levels, and social interactions. Promptly documenting these observations and reporting them to a supervisor or veterinarian is crucial for timely intervention and adherence to duty of care obligations under relevant Australian animal welfare legislation. This approach prioritizes the animal's immediate well-being and facilitates evidence-based decision-making. Incorrect approaches analysis. Dismissing subtle changes as normal behavior represents a failure to meet the duty of care. Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act, various states, requires individuals to take reasonable steps to prevent suffering. Ignoring potential signs of distress, even if subtle, could be construed as a failure to do so. Relying solely on the absence of overt aggression or panic is also problematic, as chronic stress can manifest in less dramatic ways. This approach neglects the importance of early detection and intervention, which are fundamental to good animal husbandry and welfare. Assuming an animal is fine because it is not actively vocalizing or attempting to escape overlooks a wide spectrum of distress signals and fails to demonstrate the required level of vigilance. Professional reasoning. Professionals should adopt a proactive and observant approach. This involves developing a baseline understanding of each animal's typical behavior and then actively looking for deviations. When subtle changes are noted, the professional reasoning process should involve 1. Observation. Carefully observe the behavior and the context in which it occurs. 2. Interpretation. Consider known stress indicators for the species. 3. Documentation. Record the observed behavior, time, and any contributing factors. 4. Reporting. Communicate findings to a supervisor or veterinarian for further assessment and guidance. This systematic process ensures that potential welfare issues are addressed promptly and effectively, in line with regulatory expectations and ethical responsibilities. Question 8. Implementation of a proactive approach to animal health. A Certificate Roman III in Animal Studies Health and Welfare student observes a female dog exhibiting unusual restlessness, a slight vaginal discharge that is not typical of estrus, and a decreased appetite. Considering the reproductive anatomy and physiology of canines, what is the most appropriate immediate course of action? Option A. Assume these are normal hormonal fluctuations for the dog's age and breed, and no immediate action is required beyond providing standard care. Option B. Monitor the dog closely for a few more days to see if the symptoms resolve on their own, assuming it might be a minor transient issue. Option C. Administer a broad-spectrum antibiotic purchased from a pet supply store, as vaginal discharge can sometimes indicate a mild infection. Option D. Immediately contact a veterinarian to report the observations and seek professional advice regarding further assessment and potential treatment. The correct answer is D. Immediately contact a veterinarian to report the observations and seek professional advice regarding further assessment and potential treatment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care professional to make a critical decision regarding an animal's reproductive health based on observable signs and knowledge of reproductive physiology. Misinterpreting these signs or acting without proper understanding could lead to delayed or incorrect treatment, impacting the animal's welfare and potentially leading to complications. The professional must balance immediate action with the need for accurate diagnosis and appropriate intervention, adhering to established animal welfare standards. Correct approach analysis. The correct approach involves recognizing the signs of potential reproductive distress and immediately seeking veterinary guidance. This aligns with the principles of responsible animal care, as outlined in the Certificate Roman III in Animal Studies Health and Welfare Curriculum, which emphasizes the importance of recognizing signs of illness or distress and escalating care to qualified professionals. The Australian Regulatory Framework for Animal Welfare, particularly concerning companion animals and livestock, mandates that individuals responsible for animal care must act in the best interests of the animal's health and welfare. This includes seeking veterinary attention when there are indications of reproductive abnormalities or distress, as reproductive issues can rapidly escalate and impact the animal's life. Incorrect approaches analysis. One incorrect approach is to assume the signs are minor and will resolve on their own without veterinary consultation. This fails to meet the duty of care owed to the animal and contravenes the principles of proactive animal health management. Ethically, it demonstrates a lack of diligence and could be considered neglect if the condition worsens due to inaction. Legally, it could be seen as a failure to provide adequate care, potentially breaching animal welfare legislation. Another incorrect approach is to attempt to administer over-the-counter medications or home remedies without veterinary diagnosis. This bypasses the essential step of professional veterinary assessment, which is crucial for accurate diagnosis and appropriate treatment of reproductive issues. Such actions can mask symptoms, delay effective treatment, or even exacerbate the underlying problem, leading to adverse outcomes and violating the expectation of competent animal care. A further incorrect approach is to dismiss the observed signs as normal for the animal's age or species without further investigation. While some physiological changes are normal, the described symptoms suggest a deviation from typical health. Failing to investigate further demonstrates a lack of critical observation and understanding of reproductive physiology, potentially overlooking serious conditions that require immediate veterinary intervention. This approach neglects the professional responsibility to ensure the animal is not suffering from a treatable condition. Professional reasoning. Professionals should employ a decision-making framework that prioritizes animal welfare and adheres to regulatory requirements. This involves 1. Observation and recognition. Carefully observe and document all relevant signs. 2. Knowledge application. Relate observed signs to knowledge of reproductive anatomy and physiology. 3. Risk assessment. Evaluate the potential severity and urgency of the observed signs. 4. Escalation protocol. Follow established protocols for seeking veterinary advice or intervention. 5. Documentation. Record all observations, actions taken, and communications. This systematic approach ensures that animal welfare is paramount and that all actions are justifiable within the scope of professional practice and regulatory guidelines. Question 9. Risk assessment procedures indicate that a facility will be housing both rabbits and guinea pigs in adjacent enclosures. Considering the distinct anatomical differences between these species, which of the following approaches best ensures their safety and welfare? Option A. Implementing identical enclosure designs and handling protocols for both species, as they are both small herbivores. Option B. Developing separate, species-specific enclosure designs and handling protocols based on a thorough understanding of rabbit and guinea pig anatomy and behavior. Option C. Relying on general advice for small mammal care without specific research into the anatomical needs of rabbits and guinea pigs. Option D. Focusing solely on general enclosure security to prevent escape, assuming that minor anatomical differences will not significantly impact welfare. The correct answer is A. Implementing identical enclosure designs and handling protocols for both species, as they are both small herbivores. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal care professional to move beyond general knowledge of animal health and welfare and apply specific, nuanced understanding of species-specific anatomy to a practical risk assessment. Misinterpreting or overlooking these differences can lead to inadequate safety protocols, potential harm to the animals, and noncompliance with animal welfare standards. The professional must exercise careful judgment to ensure that the chosen containment and handling methods are appropriate for the unique physiological characteristics of each species. Correct approach analysis. The correct approach involves a thorough review of the specific anatomical and physiological needs of both the rabbit and the guinea pig, focusing on their distinct skeletal structures, respiratory systems, and typical behaviors. For instance, rabbits have more delicate skeletal structures and a different digestive system compared to guinea pigs. Understanding these differences allows for the selection of appropriate housing that prevents injury, e.g., ensuring cage bar spacing is suitable for a rabbit's size and agility, and that flooring is gentle on guinea pig feet, and appropriate handling techniques that minimize stress and risk of fracture. This aligns with the principles of responsible animal care mandated by the Certificate Roman III in Animal Studies Health and Welfare, which emphasizes providing for the specific needs of different species to ensure their health and welfare. Incorrect approach is analysis. One incorrect approach would be to assume that because rabbits and guinea pigs are both small herbivores, they can be housed and handled using identical methods. This fails to acknowledge significant species-specific anatomical differences, such as the rabbit's more fragile spine and the guinea pig's susceptibility to certain types of stress. This oversight could lead to inadequate enclosure design, potentially causing injury to the rabbit, or inappropriate handling that stresses the guinea pig, impacting its welfare. This violates the duty of care to provide species-appropriate environments and handling, a core tenet of animal welfare regulations. Another incorrect approach would be to prioritize only the most common risks associated with small animals, such as escape or minor injury, without considering the unique anatomical vulnerabilities of each species. For example, focusing solely on escape prevention might lead to a secure enclosure that, due to its design, is uncomfortable or injurious for one of the species. This demonstrates a lack of deep understanding of species-specific anatomy and its implications for risk assessment, leading to a failure to implement comprehensive welfare measures as required by the qualification standards. A further incorrect approach would be to rely on anecdotal evidence or general pet care advice, rather than consulting authoritative resources on the specific anatomical and behavioral needs of rabbits and guinea pigs. This can perpetuate misinformation and lead to suboptimal care. The Certificate Roman III in Animal Studies Health and Welfare requires professionals to base their practices on evidence-based knowledge, including understanding species-specific anatomy, to ensure the highest standards of animal health and welfare. Professional reasoning. Professionals should adopt a systematic approach to risk assessment that begins with identifying the species involved. For each species, they must then research and understand its unique anatomical, physiological, and behavioral characteristics. This knowledge should then be applied to identify potential risks specific to that species within the given environment and handling context. The next step involves evaluating the likelihood and severity of these risks and implementing control measures that are tailored to the species' needs. Finally, professionals must regularly review and update these assessments and control measures to ensure ongoing compliance with animal welfare legislation and best practice. Question 10. Investigation of a domestic cat found with a visible laceration on its hind leg, bleeding moderately and exhibiting signs of pain and distress. The animal is otherwise alert. What is the most appropriate immediate course of action for a Certificate Roman III in Animal Studies Health and Welfare student or graduate? Option A. Gently clean the wound with saline solution, apply a light pressure bandage, and immediately contact a veterinarian for further advice and assessment. Option B. Administer a small dose of human pain relief medication to ease the cat's discomfort. Option C. Observe the cat from a distance and wait to see if the bleeding stops on its own. Option D. Attempt to suture the wound using a basic first aid kit as the bleeding is not severe. The correct answer is A. Gently clean the wound with saline solution, apply a light pressure bandage, and immediately contact a veterinarian for further advice and assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate action in a stressful situation where an animal's welfare is at risk. The challenge lies in accurately assessing the severity of the injury, determining the most appropriate first aid intervention, and understanding the limitations of one's own skills and the scope of practice within the certificate Roman III in Animal Studies Health and Welfare Framework. It demands a balance between proactive care and knowing when to escalate to professional veterinary assistance, adhering strictly to Australian animal welfare legislation and industry guidelines. Correct approach analysis. The correct approach prioritizes the animal's immediate safety and comfort while recognizing the need for professional veterinary assessment. This aligns with the Prevention of Cruelty to Animals Act 1979, NSW, or equivalent state legislation, which mandates providing appropriate care and preventing suffering. By stabilizing the animal and contacting a veterinarian, the individual is acting within their scope of practice as a certificate Roman III qualified individual, ensuring that advanced medical treatment is sought promptly. This demonstrates responsible animal care, ethical practice, and compliance with regulatory expectations for animal welfare. Incorrect approaches analysis. One incorrect approach involves attempting complex wound management without veterinary guidance. This could lead to further injury, infection, or delay in appropriate treatment, potentially breaching the duty of care under animal welfare legislation. It oversteps the boundaries of basic first aid and enters the realm of veterinary practice, which is outside the scope of a certificate Roman III qualification. Another incorrect approach is to do nothing, assuming the animal will recover on its own. This passive response fails to meet the legal and ethical obligation to provide care and prevent suffering, directly contravening animal welfare laws. It demonstrates a lack of understanding of basic animal first aid principles and a failure to recognize signs of distress or injury that require intervention. A third incorrect approach might be to administer over-the-counter human medications without veterinary advice. This is dangerous as animal physiology differs significantly from human physiology, and many human medications are toxic to animals. This action could cause severe adverse reactions, further harm the animal, and constitute a failure to provide appropriate care, potentially leading to legal repercussions under animal welfare legislation. Professional reasoning. When faced with an injured animal, a professional decision-making process involves 1. Immediate safety assessment for both the animal and oneself. 2. Rapid visual assessment of the injury to determine its apparent severity. 3. Application of basic first aid principles to stabilize the animal and prevent further harm, e.g., controlling bleeding, providing warmth. 4. Recognizing the limitations of one's training and the need for professional veterinary intervention. 5. Promptly contacting a veterinarian for advice and to arrange for further treatment. 6. Documenting the incident and actions taken. This systematic approach ensures that the animal receives the best possible care within the legal and ethical framework. Question 11. Stakeholder feedback indicates a need to reinforce the importance of precise terminology in animal care. During a routine health check, an animal attendant reports observing a red patch on the back of the front leg. As a veterinary professional, how should this observation be accurately documented and communicated to ensure optimal animal welfare and compliance with health and welfare guidelines? Option A. Document and communicate the finding as a raised red area on the limb. Option B. Document and communicate the finding as a erythematous macule on the dorsal aspect of the thoracic limb. Option C. Document and communicate the finding as a skin irritation on the forelimb. Option D. Document and communicate the finding as a red spot on the front of the leg. The correct answer is B. Document and communicate the finding as a erythematous macule on the dorsal aspect of the thoracic limb. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for miscommunication regarding an animal's medical condition. The use of informal or imprecise terminology can lead to misunderstandings between veterinary professionals, animal attendants, and owners, potentially impacting the animal's welfare and treatment. The core challenge lies in ensuring clarity and accuracy in communication, especially when discussing sensitive medical information. Correct approach analysis. The correct approach involves using precise anatomical and procedural terminology. This aligns with the Australian regulatory framework for animal health and welfare, which emphasizes accurate record-keeping and communication to ensure appropriate care. For instance, correctly identifying a lesion on the dorsal aspect of the thoracic limb is crucial for diagnosis and treatment planning, preventing misinterpretation that could lead to incorrect medication or procedures. This adherence to precise language is a cornerstone of professional practice, ensuring continuity of care and minimizing the risk of error. Incorrect approach is analysis. Using vague or colloquial terms like sore spot or bump on the leg is professionally unacceptable. This fails to meet the standards of accuracy required by animal health regulations and can lead to misdiagnosis or inappropriate treatment. It demonstrates a lack of understanding of essential anatomical and medical terminology, which is a core competency for Certificate Roman III in Animal Studies Health and Welfare. Such imprecision can result in the animal not receiving the correct care, potentially causing further suffering or delaying recovery, which is a direct contravention of animal welfare principles. Confusing anatomical terms, such as referring to the front of the leg when meaning the anterior aspect, introduces ambiguity. This can lead to confusion during physical examinations or when administering treatments, potentially causing harm. Regulatory guidelines for animal care mandate clear and unambiguous communication to ensure the safety and well-being of the animal. Failing to document the location and nature of the abnormality using standard veterinary terms, even if verbally communicated, is also a failure. Accurate record-keeping is a legal and ethical requirement. Without precise documentation, it becomes difficult to track the animal's progress, communicate effectively with other professionals, or provide a history if the animal is transferred, all of which are critical for ongoing welfare and compliance. Professional reasoning. Professionals should adopt a systematic approach to communication. This involves 1. Identifying the specific anatomical region and the nature of the abnormality. 2. Using precise, universally understood veterinary terminology. 3. Documenting all findings accurately in the animal's record. 4. Confirming understanding with colleagues or owners, especially when complex medical information is involved. This structured approach ensures clarity, accuracy, and adherence to professional and regulatory standards, prioritizing the animal's welfare. Question 12. Compliance review shows that the current enrichment program for the facility's rabbits may not be fully aligned with the latest Australian animal welfare standards and guidelines for housing and enrichment. What is the most appropriate course of action to address this finding? Option A. Acknowledge the review but dismiss the findings, assuming the current practices are sufficient and no changes are necessary. Option B. Continue with the existing enrichment program, as it has been in place for many years, and the rabbits appear to be content. Option C. Implement new enrichment activities based on popular trends seen on social media, without formally reviewing the Australian animal welfare standards and guidelines. Option D. Immediately consult the current Australian animal welfare standards and guidelines relevant to rabbits, and based on this, develop and implement an updated enrichment plan that demonstrably enhances welfare. The correct answer is D. Immediately consult the current Australian animal welfare standards and guidelines relevant to rabbits, and based on this, develop and implement an updated enrichment plan that demonstrably enhances welfare. Explanation. Scenario analysis. This scenario presents a common implementation challenge in animal care facilities where established routines may not fully align with evolving best practices in animal welfare. The challenge lies in balancing operational efficiency with the ethical and legal imperative to provide the highest standard of care. Staff adherence to protocols, even if outdated, can create resistance to change, making the implementation of new welfare initiatives difficult. The professional challenge is to identify and address these gaps effectively while maintaining staff morale and ensuring consistent, high-quality animal care. Correct approach analysis. The correct approach involves a proactive and evidence-based review of current practices against the principles of the Australian animal welfare standards and guidelines. This aligns with the Certificate Roman III in Animal Studies Health and Welfare curriculum's emphasis on understanding and applying these standards. Specifically, it requires consulting the relevant Australian animal welfare standards and guidelines for the species in question, identifying any discrepancies, and then developing and implementing revised protocols that demonstrably improve welfare outcomes. This approach is best professional practice because it is grounded in regulatory compliance, ethical responsibility, and a commitment to continuous improvement in animal care. It ensures that the facility is not only meeting, but exceeding minimum welfare requirements, fostering a positive and healthy environment for the animals. Incorrect approach is analysis. One incorrect approach involves continuing with existing protocols simply because they have been in place for a long time. This fails to acknowledge the dynamic nature of animal welfare science and regulatory updates. Ethically, it risks animal suffering if current practices are suboptimal. Legally, it could lead to noncompliance with Australian animal welfare standards and guidelines, potentially resulting in penalties. Another incorrect approach is to implement changes based solely on anecdotal evidence or personal opinions, without consulting the official Australian animal welfare standards and guidelines. This is professionally unsound, as it lacks a basis in established best practice and regulatory requirements. It could lead to changes that are ineffective or even detrimental to animal welfare, and it bypasses the necessary due diligence required for regulatory compliance. A third incorrect approach is to dismiss the compliance review findings without further investigation, assuming current practices are adequate. This demonstrates a lack of commitment to animal welfare and a failure to engage with potential areas for improvement. It is a direct contravention of the professional duty of care owed to the animals and a disregard for the regulatory framework governing animal health and welfare in Australia. Professional reasoning. Professionals in animal care must adopt a systematic and evidence-based approach to animal welfare. When faced with a compliance review, the first step is to understand the findings and their implications. This involves consulting the relevant Australian animal welfare standards and guidelines to ascertain the regulatory requirements and best practices. The next step is to critically evaluate current practices against these standards, identifying any gaps or areas for improvement. Based on this evaluation, a plan for implementing necessary changes should be developed, ensuring that staff are adequately trained and that the changes are monitored for effectiveness. This decision-making process prioritizes animal welfare, regulatory compliance, and continuous professional development. Question 13. The control framework reveals that when presented with a sick or injured animal, a certificate Roman III in animal studies health and welfare student must ensure the animal receives appropriate care. Considering the legislative requirements of New South Wales, which of the following actions best aligns with the Prevention of Cruelty to Animals Act 1979, NSW, and the associated animal welfare standards and guidelines? Option A. Rely on personal experience and common sense to provide basic comfort and food, assuming the animal will recover on its own. Option B. Immediately consult the Prevention of Cruelty to Animals Act 1979, NSW, and relevant animal welfare standards and guidelines to determine the appropriate course of action, including seeking veterinary advice if necessary, and ensuring the animal's housing and care meet legislative requirements. Option C. Seek advice from a colleague who has worked with similar animals, without consulting official legislation or veterinary professionals. Option D. Prioritize completing other scheduled tasks before addressing the sick or injured animal, as long as it is not in immediate visible distress. The correct answer is B. Immediately consult the Prevention of Cruelty to Animals Act 1979, NSW, and relevant animal welfare standards and guidelines to determine the appropriate course of action, including seeking veterinary advice if necessary, and ensuring the animal's housing and care meet legislative requirements. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an individual to navigate potentially conflicting interpretations of animal welfare legislation and apply them to a practical situation involving animal care. The challenge lies in understanding the nuances of the legislation and ensuring that actions taken are not only compliant, but also uphold the highest ethical standards for animal welfare, as mandated by the Certificate Roman III in Animal Studies Health and Welfare Curriculum. Correct approach analysis. The correct approach demonstrates best professional practice by directly referencing and applying the principles of the Prevention of Cruelty to Animals Act 1979, NSW, and the associated animal welfare standards and guidelines. This approach is ethically sound and legally compliant because it prioritizes the animal's well-being by ensuring it receives appropriate veterinary care and is housed in conditions that meet its specific needs, as defined by the legislation. It reflects a proactive and responsible attitude towards animal welfare. Incorrect approaches analysis. One incorrect approach fails by relying solely on personal opinion or anecdotal evidence regarding animal care. This is a regulatory failure because it bypasses the legally binding requirements of animal welfare legislation, such as the Prevention of Cruelty to Animals Act 1979, NSW, which sets minimum standards for care. Ethically, it is unacceptable as it can lead to substandard care and potential suffering for the animal. Another incorrect approach is to assume that general knowledge of animal care is sufficient without consulting specific legislative requirements. This is a regulatory failure because it neglects the detailed provisions within the animal welfare standards and guidelines that are crucial for compliance. Ethically, it risks overlooking specific needs or prohibitions outlined in the law, potentially causing harm. A further incorrect approach might involve prioritizing cost-effectiveness over the animal's welfare needs. This is a significant regulatory and ethical failure. The Prevention of Cruelty to Animals Act 1979, NSW, and associated guidelines clearly stipulate that the welfare of the animal is paramount, and financial considerations should not compromise this. Such an approach would likely result in inadequate care, stress, or suffering for the animal, directly contravening legal obligations. Professional reasoning. Professionals in animal studies must adopt a systematic decision-making process. This involves first identifying the relevant legislation and guidelines applicable to the specific jurisdiction, in this case, NSW. Then they must thoroughly understand the requirements of that legislation concerning the animal's species, age, health status, and environmental needs. Any proposed course of action should be evaluated against these legal and ethical benchmarks. If there is any doubt or ambiguity, seeking guidance from a supervisor or consulting official resources is essential. This ensures that decisions are informed, compliant, and uphold the highest standards of animal welfare. Question 14. The analysis reveals that a domestic rabbit, housed in a clean and appropriately enriched environment, is exhibiting intermittent, shallow breathing and a slight tremor in its hindquarters when resting. The carer is concerned about the rabbit's well-being. Considering the basic anatomy of common domestic animals, what is the most appropriate initial assessment and course of action? Option A. Contact a veterinarian immediately to report a suspected respiratory infection and administer oxygen therapy as a precautionary measure. Option B. Isolate the rabbit in a quiet, dark enclosure and withhold food and water to reduce stress and observe for further changes. Option C. Immediately administer a broad-spectrum pain relief medication to alleviate any potential discomfort, as tremors can indicate pain. Option D. Assess if the breathing pattern and tremor are consistent with normal resting behaviors for rabbits, considering their prey animal instincts and potential for subtle physiological responses to environmental stimuli, before considering further intervention. The correct answer is D. Assess if the breathing pattern and tremor are consistent with normal resting behaviors for rabbits, considering their prey animal instincts and potential for subtle physiological responses to environmental stimuli, before considering further intervention. Explanation. The analysis reveals a common scenario in animal care where a seemingly minor observation requires a deeper understanding of basic anatomy to ensure appropriate welfare. The challenge lies in distinguishing between normal physiological variations and signs of distress or illness, which directly impacts the animal's health and the effectiveness of any intervention. Accurate anatomical knowledge is fundamental to this distinction. The correct approach involves recognizing that the observed behavior, while unusual, is not necessarily indicative of a serious problem if it aligns with the known anatomical and physiological characteristics of the species and breed. For example, certain breeds of dogs have specific facial structures that can lead to snoring or snorting sounds during sleep, which is a normal anatomical consequence. This approach demonstrates best professional practice by prioritizing observation, applying foundational anatomical knowledge, and avoiding unnecessary alarm or intervention. It aligns with the principles of animal welfare legislation in Australia, such as the Prevention of Cruelty to Animals Act 1986 (VIC), or equivalent state legislation, which mandates that animals must be provided with adequate care and treatment to alleviate suffering. By understanding normal anatomy, a carer can correctly assess if an animal is experiencing pain or distress, thereby fulfilling their duty of care. An incorrect approach would be to immediately assume the animal is in distress and administer a treatment or escalate to a veterinarian, without considering normal anatomical variations. This could lead to unnecessary stress for the animal, potential side effects from inappropriate treatment, and wasted resources. Ethically, this fails to uphold the principle of do no harm by potentially causing iatrogenic issues. From a regulatory perspective, it could be seen as a failure to exercise due diligence in animal care, potentially breaching the duty of care obligations under animal welfare legislation. Another incorrect approach would be to ignore the observation entirely, assuming it is insignificant. This is a failure of professional responsibility. If the observed behavior is indeed a symptom of an underlying anatomical issue or illness, ignoring it could lead to delayed diagnosis and treatment, resulting in prolonged suffering for the animal and potentially more severe health consequences. This directly contravenes the legislative requirement to provide appropriate care and to prevent cruelty. The professional decision-making process for similar situation should involve a systematic approach. 1. Observe and document the behavior accurately. 2. Access and apply knowledge of the animal's species, breed, age, and any known pre-existing conditions. 3. Consult reliable resources on basic anatomy and physiology relevant to the observed behavior. 4. Differentiate between normal physiological functions and potential signs of distress or illness. 5. If uncertainty remains or if the behavior suggests potential suffering, consult with a supervisor or veterinarian. 6. Implement appropriate care or intervention based on the assessment, always prioritizing the animal's welfare. Question 15. The audit findings indicate inconsistencies in the recording of daily health observations for animals in the facility, with some entries lacking detail on specific behavioral changes or physical signs. What is the most appropriate immediate course of action to address these findings and ensure compliance with Australian animal welfare standards? Option A. Conduct a comprehensive review of the facility's current health assessment and monitoring protocols. Identify specific gaps based on the audit findings, and implement targeted staff training on accurate and detailed record keeping, followed by a period of close supervision and re-evaluation. Option B. Focus solely on the individuals whose records were flagged in the audit, requiring them to retake basic animal care modules without addressing the broader team's understanding or the protocol itself. Option C. Advise staff to simply be more careful when recording observations in the future, assuming the audit findings were due to oversight rather than a systemic issue. Option D. Immediately update the existing record-keeping forms to include more checkboxes, without providing additional training or guidance on what constitutes a significant observation. The correct answer is A. Conduct a comprehensive review of the facility's current health assessment and monitoring protocols, identify specific gaps based on the audit findings, and implement targeted staff training on accurate and detailed record keeping, followed by a period of close supervision and re-evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the animal care professional to interpret and act upon audit findings that highlight potential deficiencies in health assessment and monitoring protocols. The challenge lies in translating abstract audit feedback into concrete, compliant actions that ensure animal welfare and adhere to regulatory standards. The professional must balance immediate corrective actions with systemic improvements to prevent recurrence, all while maintaining a high standard of care. Correct approach analysis. The correct approach involves a systematic review of the audit findings, cross-referencing them with the relevant Australian regulatory framework for animal studies, e.g., relevant state/territory animal welfare legislation, codes of practice, and institutional animal ethics committee guidelines. This includes identifying specific areas of non-compliance or suboptimal practice in health assessment and monitoring, developing targeted training for staff on correct procedures, and implementing revised protocols with clear documentation requirements. This approach is best professional practice because it directly addresses the identified issues, ensures staff competency, and establishes a robust system for ongoing compliance and improved animal welfare, aligning with the ethical obligations and legal requirements of the Certificate Roman III in Animal Studies Health and Welfare. Incorrect approaches analysis. One incorrect approach involves dismissing the audit findings as minor or subjective without a thorough review. This is a regulatory failure as it demonstrates a disregard for the established oversight mechanisms designed to ensure compliance and animal welfare. Ethically, it prioritizes convenience over the well-being of the animals. Another incorrect approach is to implement superficial changes, such as simply rereading existing protocols without addressing the root cause of the audit findings or providing practical training. This is a failure to meet the spirit of the regulations, which require effective implementation and demonstrable understanding, not just passive acknowledgement. It also fails to address the potential for continued noncompliance and animal distress. A further incorrect approach is to blame individual staff members without investigating systemic issues or providing adequate support and training. This is ethically problematic as it fails to foster a culture of learning and improvement. It is also a regulatory failure if it leads to inadequate corrective actions that do not address the underlying procedural or knowledge gaps. Professional reasoning. Professionals should approach audit findings with a commitment to continuous improvement. The decision-making process should involve 1. Acknowledging and understanding the audit feedback. 2. Consulting the relevant Australian regulatory framework and institutional policies. 3. Identifying specific areas for improvement in health assessment and monitoring. 4. Developing and implementing practical, evidence-based solutions, including training and protocol revisions. 5. Establishing a system for ongoing monitoring and evaluation to ensure sustained compliance and welfare. Question 16. Research into the ethical considerations of animal care has highlighted the significant role of animal welfare in shaping societal attitudes and legal frameworks. Imagine you are caring for a dog exhibiting clear signs of anxiety and distress due to a recent change in its environment. You have identified a potential solution that would significantly alleviate its stress, but it requires a minor adjustment to the daily routine and a small increase in resource allocation. What is the most appropriate course of action to uphold the importance of animal welfare in society? Option A. Seek approval from multiple senior staff members before making any changes, even if it means delaying the intervention for the distressed animal. Option B. Implement the solution that addresses the dog's anxiety and distress, even if it requires a minor adjustment to the routine and a small increase in resources. Option C. Prioritize maintaining the established routine and resource allocation, as deviating from it could set a precedent for future operational changes. Option D. Continue with the current routine, as the dog's anxiety is a temporary behavioral issue that will likely resolve on its own without intervention. The correct answer is B. Implement the solution that addresses the dog's anxiety and distress, even if it requires a minor adjustment to the routine and a small increase in resources. Explanation. Scenario analysis. This scenario presents a common ethical dilemma faced by animal care professionals. The challenge lies in balancing the immediate needs of an animal with the broader societal perception and legal obligations regarding animal welfare. The professional must navigate conflicting priorities, potentially impacting the animal's immediate comfort and the facility's reputation and compliance. Correct approach analysis. The correct approach prioritizes the animal's immediate physical and psychological well-being, aligning with the core principles of animal welfare and the ethical responsibilities inherent in the Certificate Roman III in Animal Studies Health and Welfare Qualification. This approach reflects a deep understanding of the importance of animal welfare in society, recognizing that responsible care is a fundamental societal expectation and a legal requirement. It demonstrates adherence to the Australian regulatory framework, which mandates that animals under care must be provided with appropriate conditions to meet their needs, preventing suffering and promoting well-being. Incorrect approaches analysis. One incorrect approach fails to address the animal's immediate distress, prioritizing convenience or a less demanding solution over the animal's welfare. This demonstrates a disregard for the ethical imperative to alleviate suffering and a potential breach of duty of care, which is a cornerstone of animal welfare legislation in Australia. Such an approach could lead to negative welfare outcomes for the animal and reputational damage for the professional and their organization. Another incorrect approach might involve making a decision based solely on cost-effectiveness or ease of implementation, without adequately considering the animal's specific needs or the potential long-term welfare implications. This prioritizes economic or operational factors over the animal's intrinsic value and well-being, which is contrary to the ethical framework underpinning animal studies and animal welfare regulations in Australia. It fails to recognize the societal importance of treating animals with compassion and respect. A further incorrect approach could involve deferring the decision or seeking external validation, without taking immediate appropriate action to mitigate the animal's distress. While consultation is important, inaction or undue delay in addressing an animal's clear welfare concern is a failure of professional responsibility and can exacerbate the animal's suffering, contravening the proactive approach required by animal welfare standards. Professional reasoning. Professionals should adopt a systematic decision-making process. Firstly, assess the animal's immediate welfare needs and identify the source of distress. Secondly, consult relevant organizational policies and procedures, as well as applicable Australian animal welfare legislation and guidelines. Thirdly, evaluate available resources and potential solutions, prioritizing those that best meet the animal's welfare requirements. Fourthly, implement the chosen course of action promptly and document all decisions and actions taken. Finally, reflect on the outcome and identify any learning opportunities for future situations. This process ensures that decisions are ethically sound, legally compliant, and professionally responsible, upholding the importance of animal welfare in society. Question 17. Examination of the data shows a domestic rabbit exhibiting lethargy, poor coat condition with hair loss, and a tendency to chew on non-food items. The rabbit's diet consists primarily of a commercial pellet, with limited access to fresh vegetables and no hay. Based on common nutritional deficiencies and their effects relevant to the Certificate Roman III in Animal Studies Health and Welfare Curriculum, which of the following is the most likely underlying issue and the most appropriate initial course of action? Option A. A bacterial infection necessitating immediate antibiotic treatment prescribed by a veterinarian. Option B. A deficiency in fiber and essential vitamins, requiring an immediate increase in hay provision and the introduction of a variety of fresh, rabbit-safe leafy greens. Option C. A parasitic infestation, requiring deworming medication administered without further dietary assessment. Option D. An overconsumption of protein, leading to kidney issues and requiring a reduction in all food sources. The correct answer is B. A deficiency in fiber and essential vitamins, requiring an immediate increase in hay provision and the introduction of a variety of fresh, rabbit-safe leafy greens. Explanation. This scenario presents a common challenge in animal care, identifying and addressing potential health issues stemming from inadequate nutrition. The professional challenge lies in accurately diagnosing a nutritional deficiency based on observed symptoms, and then recommending appropriate interventions, all while adhering to the principles of animal welfare and relevant Australian regulations. Careful judgment is required to differentiate nutritional deficiencies from other potential causes of similar symptoms, such as disease or environmental factors. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based method for diagnosis and intervention. This involves consulting reliable resources, observing the animal's overall condition, and considering the specific dietary history. In Australia, the prevention of cruelty and the promotion of animal welfare are governed by legislation such as the Prevention of Cruelty to Animals Act (POCTA) in various states and territories, and the Australian Animal Welfare Standards and Guidelines. A responsible animal carer must act to alleviate suffering and ensure the animal's needs are met, which includes proper nutrition. An incorrect approach that relies solely on anecdotal evidence or guesswork is professionally unacceptable. This fails to meet the duty of care owed to the animal and could lead to delayed or incorrect treatment, exacerbating the animal's condition. Ethically, it demonstrates a lack of diligence and commitment to the animal's well-being. Furthermore, such an approach could contravene the principles of responsible animal management, potentially leading to breaches of animal welfare legislation if the animal's suffering is prolonged or worsened due to negligence. Another incorrect approach that involves administering unverified supplements without a proper diagnosis is also professionally unsound. This can be ineffective, costly, and potentially harmful if the supplement interacts negatively with the animal's existing health status or if the deficiency is misidentified. It bypasses the crucial diagnostic step and can mask underlying issues. The professional decision-making process for similar situations should involve a structured approach. 1. Observation and data gathering. Carefully observe the animal's behavior, physical condition, and environment. Collect all available information about its diet, living conditions, and any recent changes. 2. Information seeking. Consult reputable sources such as veterinary texts, industry guidelines, and potentially veterinary professionals to understand common nutritional deficiencies and their associated symptoms. 3. Differential diagnosis. Consider all possible causes for the observed symptoms, including nutritional deficiencies, diseases, parasites, and environmental stressors. 4. Intervention and monitoring. Based on the most likely diagnosis, implement appropriate interventions such as dietary adjustments or supplementation and closely monitor the animal's response. 5. Escalation. If symptoms do not improve or worsen, seek professional veterinary advice promptly. Question 18. Operational review demonstrates that a facility houses a diverse range of animals including domestic rabbits, guinea pigs, and a small flock of laying hens. The current feeding practice involves providing a general-purpose pellet mix to all animals, supplemented with ad libitum access to hay for the rabbits and guinea pigs, and kitchen scraps for the hens. What is the most appropriate approach to ensure the nutritional requirements for these varied species are met in accordance with Australian animal welfare regulations? Option A. Increase the quantity of the general pellet mix provided to all animals to compensate for any potential nutritional gaps. Option B. Continue the current practice of providing a general pellet mix and ad libitum hay, as this has been a common practice in similar facilities. Option C. Introduce a single, high-protein feed supplement to be mixed into the general pellet for all animals to ensure adequate nutrient intake. Option D. Develop and implement species-specific feeding plans based on the Australian Animal Welfare Standards and Guidelines, AUSC, for rabbits, guinea pigs, and poultry, ensuring appropriate nutrient profiles and feeding frequencies for each. The correct answer is D. Develop and implement species-specific feeding plans based on the Australian Animal Welfare Standards and Guidelines, AUSC, for rabbits, guinea pigs, and poultry, ensuring appropriate nutrient profiles and feeding frequencies for each. Explanation. Scenario analysis. This scenario presents a common challenge in animal care settings, where a variety of species with distinct nutritional needs are housed together. The professional challenge lies in ensuring each animal receives an appropriate diet that supports its health and welfare, preventing deficiencies or excesses that could lead to illness, behavioral issues, or reduced productivity. The need for accurate species-specific knowledge and careful observation is paramount. Correct approach analysis. The correct approach involves consulting and adhering to the Australian Animal Welfare Standards and Guidelines, AUSC, for the specific species housed. These standards provide evidence-based recommendations for feeding, ensuring that the nutritional requirements for energy, protein, vitamins, and minerals are met. This approach is best professional practice as it is directly aligned with regulatory requirements and ethical obligations to provide adequate care. It demonstrates a commitment to evidence-based practice and the welfare of the animals under care, preventing potential health issues and ensuring compliance with legal obligations. Incorrect approach is analysis. One incorrect approach is to assume that all animals of a similar size or type have identical nutritional needs. This fails to acknowledge the significant species-specific variations in metabolism, digestive systems, and nutrient requirements, potentially leading to malnutrition or diet-related diseases. This approach violates the AUSC by not providing adequate nutrition tailored to the specific species. Another incorrect approach is to rely solely on anecdotal evidence or the feeding practices of other facilities, without verifying their suitability for the specific species and their current health status. This can perpetuate outdated or inappropriate feeding regimes and may not meet the current understanding of nutritional science or regulatory expectations. It represents a failure to exercise due diligence and a potential breach of the duty of care under the AUSC. A further incorrect approach is to provide a single, generic feed mix to all animals, regardless of species, age, or physiological state. This is highly likely to result in nutritional imbalances for many of the animals, leading to health problems and contravening the fundamental principles of providing appropriate care as outlined in the AUSC. Professional reasoning. Professionals should adopt a systematic approach to dietary management. This involves 1. Identifying all species and individual animals under care. 2. Researching and understanding the specific nutritional requirements for each species, referencing the AUSC and other reputable, jurisdiction-specific resources. 3. Developing and implementing feeding plans that cater to these individual needs, considering age, health status, and activity levels. 4. regularly monitoring animal health, body condition, and behavior for any signs of nutritional issues. 5. Consulting with veterinary professionals or qualified animal nutritionists when necessary. This structured process ensures that all animals receive optimal nutrition, promoting their health and welfare while maintaining regulatory compliance. Question 19. To address the challenge of accurately assessing and promoting the well-being of animals under care, which of the following best defines animal health and welfare within the context of the Certificate Roman III in Animal Studies Health and Welfare Curriculum and Australian regulatory frameworks? Option A. Animal health and welfare is determined by whether the animal is adequately fed and sheltered, with minimal disruption to human operations. Option B. Animal health and welfare is primarily defined by the absence of observable signs of disease or injury, ensuring the animal is physically sound. Option C. Animal health and welfare is solely focused on meeting the basic physiological needs of the animal, such as food and water, without significant consideration for its emotional state. Option D. Animal health and welfare is a state of complete physical, mental, and social well-being, where the animal is free from pain, suffering, hunger, thirst, discomfort, fear, and distress, and is able to express normal behaviors. The correct answer is D. Animal health and welfare is a state of complete physical, mental, and social well-being, where the animal is free from pain, suffering, hunger, thirst, discomfort, fear, and distress, and is able to express normal behaviors. Explanation. The scenario presents a professional challenge because defining animal health and welfare is not a static or universally agreed-upon concept. It requires professionals to move beyond simplistic notions of merely the absence of disease and consider a broader spectrum of physical, mental, and environmental factors. This complexity demands careful judgment to ensure that practices align with current scientific understanding and ethical obligations, as mandated by the Certificate Roman III in Animal Studies Health and Welfare Curriculum. The correct approach represents best professional practice because it acknowledges the multifaceted nature of animal welfare, encompassing physical health, psychological well-being, and the ability to express natural behaviors. This aligns with the principles embedded in Australian animal welfare legislation, which often refers to the 5 freedoms or 5 domains model, promoting a holistic view. Adhering to this comprehensive definition ensures that care provided is not just about survival, but about promoting a good quality of life for the animal, reflecting the ethical standards expected of a Certificate Roman III graduate. An incorrect approach that focuses solely on the absence of visible disease fails to meet regulatory and ethical standards. This is because it neglects the psychological and behavioral aspects of welfare, potentially leading to animals suffering from stress, boredom, or frustration without overt physical signs. Such an approach would contravene the spirit and often the letter of animal welfare laws, which aim to prevent suffering in all its forms. Another incorrect approach that prioritizes human convenience or economic efficiency over the animal's needs is ethically unacceptable. This demonstrates a failure to recognize the intrinsic value of the animal and its right to appropriate care. It would likely violate specific provisions within animal welfare legislation that mandate the provision of adequate food, water, shelter, and freedom from distress. The professional reasoning process for similar situations should involve a systematic evaluation of the animal's needs against established welfare principles and relevant legislation. This includes observing the animal for subtle signs of distress, considering its species-specific behaviors, and understanding the environmental factors that influence its well-being. Professionals should consult with supervisors or experienced colleagues when in doubt and prioritize the animal's welfare as the primary consideration in all decision-making. Question 20. Analysis of how a Certificate Roman III in Animal Studies Health and Welfare student should best evaluate and manage the social structures of different animal species in a care setting, considering the potential impact on animal welfare. Option A. Focus on providing basic necessities like food and water, assuming social dynamics will resolve themselves. Option B. House all animals of the same species together to maximize efficiency, assuming they will adapt. Option C. Treat each animal as an individual and provide ample physical space without considering their social needs or interactions. Option D. Prioritize understanding species-specific social behaviors and observed individual interactions to create compatible groupings and minimize stress. The correct answer is D. Prioritize understanding species-specific social behaviors and observed individual interactions to create compatible groupings and minimize stress. Explanation. Scenario analysis. This scenario is professionally challenging because understanding and respecting the social structures of different animal species is fundamental to providing appropriate welfare and care. Misinterpreting or ignoring these structures can lead to stress, behavioral problems, and compromised health for the animals. Professionals must apply their knowledge to practical situations, making informed decisions about social groupings and individual animal needs. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the animal's welfare through a thorough understanding of species-specific social behaviors. This aligns with the principles of responsible animal care and management, which are implicitly or explicitly covered by the Certificate Roman III in Animal Studies Health and Welfare Curriculum. It involves observation, research, and application of knowledge to create an environment that minimizes stress and promotes natural behaviors, thereby meeting the animal's physical and psychological needs. This approach is ethically sound and reflects a commitment to high standards of animal husbandry. Incorrect approaches analysis. One incorrect approach fails by assuming all animals of the same species can be housed together without regard for their social dynamics. This ignores the potential for aggression, competition, or stress arising from incompatible social groupings, which is a failure in applying basic animal behavior principles and can lead to welfare issues. Another incorrect approach overlooks the importance of social interaction altogether, treating animals as isolated individuals. This neglects the fact that many species are inherently social, and their well-being is significantly impacted by their social environment. Failure to provide appropriate social opportunities can result in behavioral deficits and psychological distress, contravening the welfare standards expected in animal care. A further incorrect approach focuses solely on the physical space provided, without considering the social implications of stocking density or the composition of the group. While adequate space is important, it does not negate the need for compatible social structures. This approach is a failure to consider the holistic welfare needs of the animals, focusing on a single aspect of care while neglecting crucial social dynamics. Professional reasoning. Professionals should approach situations involving animal social structures by first identifying the species and researching its known social behaviors and requirements. This should be followed by careful observation of the specific animals in question, noting their interactions and individual temperaments. Based on this information, decisions regarding housing, social grouping, and enrichment should be made, always prioritizing the welfare and natural behaviors of the animals. This systematic approach ensures that care practices are evidence-based, ethical, and compliant with the standards expected of a Certificate Roman III in Animal Studies Health and Welfare graduate.